Welcome to Care West's Safe Visiting Practices video. We will outline everything you need to know to ensure a safe visit at our care centers. We ask that all visitors familiarize themselves with the processes and safe visiting practices before visiting. The Chief Medical Officer of Health of Alberta announced updated Safe Visitor Access Guidelines for continuing care. Under these new guidelines, residents and clients can designate up to 4 designated family support persons. Please come 15 minutes early for your scheduled visit to allow for health screening and masking. When you arrive at the screening station, please tell us your name, who you are visiting, and what area you will be visiting. Screening will involve a temperature check, answering the COVID-19 screening questionnaire, confirmation of self-assessment of risk of unknown exposure to COVID-19, and understanding of safe visiting practices. Safe Visiting Practices is a document outlining all this information, which you can find on our website at carewest.ca/COVID. The self-assessment of risk of unknown exposure to COVID-19 is a personal risk assessment visitors should take before attending the care center. It is important that persons understand their risk of unknown exposure to COVID-19 based on their behavior in the last 14 days prior to entering the site. Using the criteria in the assessment, would you consider yourself low risk, medium risk, or high risk? Individuals who consider themselves high risk should not visit. Only low risk individuals may visit. Once you are in the visiting space, there are a few expectations of visitors. Those include continuous masking, physical distancing, hand hygiene, and how to engage in safe physical touch. Continuous masking is expected for the duration of the visit. You may bring your own mask if you wish, but if you do not have a mask, the site will provide one for you. Please perform hand hygiene prior to putting your mask on, before and after taking it off. If your mask is disposable, please dispose of your mask in the garbage. You may be required to wear additional personal protective equipment, and the staff will assist you to put it on and take it off. Physical distancing of more than 2 meters is one of the more powerful tools we have to reduce the spread of COVID-19. This is because droplets from coughs, sneezes, or even talking do not commonly travel farther than 2 meters. To help us in preventing the spread of the virus in our care centers, please stay more than 2 meters apart from those around you, including the person you are visiting and our staff, unless you are involved in providing direct care for a resident. Cleaning and disinfecting your hands is proven to reduce the risk of transmission. Please perform hand hygiene upon entering the unit, before entering the room, after exiting the room, before leaving the care center, and as discussed earlier, before putting on and before and after taking off your mask. The risk of transmission of COVID-19 increases with close proximity. If a resident and their visitors understand this and wish to include physical touch in their visits, this may be done by continuously wearing a mask that covers the nose and mouth while within 2 meters of the resident. Perform hand hygiene both before and after direct physical contact with the resident, and inform staff immediately if the resident becomes symptomatic during the visit. Though residents do not need to wear a mask, they may choose to do so based on their own risk of unknown exposure from off-site activity. All designated family support persons may access resident rooms, private and shared, up to a maximum of 4 visitors. In extenuating circumstances, more visitors may be allowed in the room. Family support persons may also attend in shared care areas like dining rooms and bathing rooms, up to a maximum of 1 visitor with the resident for the provision of care. For outdoor visits, visitors may attend up to a maximum of 10, including the resident, providing that physical distancing can be maintained between those of different households. All visits must be pre-arranged by the site. We also encourage family support persons to set a regular visiting schedule with their loved one. Please ensure you remain in the designated visiting area for the entire duration of your visit. You are welcome to send gifts, including flowers, to your loved one. All items being brought into the care center must be wiped down thoroughly before entering the building. Food can also be brought but not shared between multiple people. All food must be packaged for individual use. Each Care West site has completed a risk tolerance assessment and surveyed residents, family members, and staff, as well as assessed the building capacity. This risk tolerance assessment will further inform our indoor visitation practices. Please follow all practices and procedures as designated by your site, including time limits on visiting, hours of operation, designated visiting areas, and of course, all hand hygiene, physical distancing, and masking precautions. There may be times during an outbreak when there are more restrictions. Please check with your site in the event of an outbreak. We know these are challenging times, and we will do our best to work together when you have concerns about any of these processes or questions about how we follow the current CMOH order. However, if concerns continue, you do have access to a dispute resolution process. More information about this process is on carewest.ca/COVID. Thank you for taking the time to watch CareWest's Safe Visiting Practices video. We hope your visits are enjoyable and safe.